Hey everyone, welcome back to the channel. My name is Aryan Malik. I am a third year nursing student, and this is Study With Me series day 32. We'll be continuing our discussion on OB, and this is part 3 in the series. We'll continue where we left off yesterday. So, the site where the egg, the oocyte, pops out of the ovary, corpus luteum gets formed. Now, what is corpus luteum? So, corpus luteum it is something that begins to release the most important hormone of the pregnancy, which is progesterone. So, corpus luteum is responsible for secreting progesterone. And why is progesterone necessary? So adequate amounts of progesterone are necessary for implantation, that is for the fertilized egg to implant in the uterus and also to maintain pregnancy. So we say some patients come and they say they were pregnant and then they just lost it. So say a patient says I got pregnant, I had the positive pregnancy test and then I lost it. So one of the first things that we as a registered nurse ask ourselves is what is that woman's progesterone level. So we want to check progesterone levels because low levels of progesterone can lead to loss of pregnancy. So corpus luteum initially makes progesterone. Progesterone it basically makes the uterus become even more thicker, and it has also a hyperthermic effect, so meaning it raises the woman's temperature slightly, say by zero point 0.5 or zero point 0.6 degrees, example 99.4 degree. The important thing to know is it raises the temperature slightly, not significantly. Now, while I was working or kind of reading my book, I had a question: does age affect progesterone or progesterone levels? So, what I found out was, or what my professor told me was, it shouldn't affect if the woman is ovulating the way she was ovulating uh, in years before, like when she was maybe now she's in her late 40s, but the when she was in her 30s or even 20s. So if she's ovulating the same way, if she has the same menstrual cycle, then the progesterone levels shouldn't be different. So in the United States, the average age for menopause for women is 50 to 52. Before menopause, which is basically cessation of menopause for a year, meaning no periods for a year, and then a woman can say that they are at menopause. The period before menopause, or as we call it, perimenopausal, could be years and years and years, and during this stage the hormones are all over the place, they're turbulent, and the woman could experience hot flashes. We have seen that more spontaneous pregnancy losses are prevalent among the women who are older, and there are multiple factors that are the reason for the same. It is the age, also the eggs, the oocyte are older, and there is also a paternal factor, the sperm. So as we all know, it's 50% contribution from the woman and 50% from the males. So it can also be the paternal factor that can lead to the loss of pregnancy. And what's um, very scary for me was to find out that sometimes the women lose pregnancy and we can't we can't even determine the reason for it. And so it is irrespective of age. Women in their 20s or women even in 40s sometimes lose their pregnancy, and healthcare providers are unable to determine what resulted in the pregnancy loss. Now, let's go to endothelial or uterine cycle. It's basically a response to hormonal changes, and this cycle basically tells us what is going on in the uterus. So when we take OB history from a woman, we ask them what is the first day of your last menstrual period, because that is going to help us calculate their due date. When a woman has their period, it is at the lining of the uterus which is built up, and it kind of breaks down and leaves their body. A menstrual cycle is basically cells, blood, and sometimes some clots, but it is basically the shedding of the lining of the uterus. Most women have their menstrual cycle for 3 to 5 days. It's an average. Some women may have it for 7, and some may have it for 2. Once that's done, the woman goes into the proliferative phase. Proliferative phase coincides with the follicular phase, which we discussed yesterday. So, follicular phase is basically where more and more eggs are getting produced, and one of them is preparing to be the most mature, which will in turn get fertilized with the sperm. So, as multiple eggs are maturing, the lining of the uterus is getting thicker. So, proliferative phase is coinciding with follicular phase. Both things are happening at the same time. As the eggs are multiplying and maturing, the lining of the uterus is getting thicker. And this process lasts until ovulation, or in other terms, the release of the egg. Ovulation happens, as we learned yesterday, because there is a surge in luteinizing hormone, which basically says to the egg to go away, or just kind of makes it drop, and it causes the egg to be released from the ovary. The egg then enters the fallopian tube, the fibrae, what we talked specifically, and starts its journey. If the egg is released and a woman engages in unprotected sexual activity, and then they become pregnant, which is like basically conception, which is forming of the egg and sperm, it occurs in the fallopian tube, and that early pregnancy starts to move. It continues its journey through the fallopian tube and should implant itself in the upper part of the uterus. So, as we learn, corpus luteum, it releases progesterone, and progesterone, it makes the uterus even thicker, because a pregnancy needs a thick uterus. And during pregnancy, the body needs a lot of blood and vascular connections to support the pregnancy. So basically, what we learned here was the body's preparation for implantation. Now, if the egg and sperm have joined together, basically, if the fertilization has successfully taken place, and now the pregnancy has flowed through the fallopian tubes, and then it attaches itself in the upper part of the uterus, the body then continues to make progesterone through the corpus luteum and eventually through placenta to maintain the pregnancy. So let's say a woman ovulates and does not engage in sexual activity, does not become pregnant, that egg does not become fertilizer, so it comes down, falls apart, and withers away. The uterus which on the other hand had been growing, realizes it does not need to grow anymore. It starts to shed when the woman gets her next menstrual cycle. So the whole process here, as we saw, is influenced by hormones. As registered nurses, it's important for us during the initial assessment to know and ask the client their first day of their last menstrual cycle. Do they have adequate hormones to trigger things and then support the pregnancy? Some clients do have light period and they can still be pregnant, and this is usually because of the reason that they do not have adequate progesterone. That marks the end of this section. Please stay tuned for the part 4 that comes out tomorrow. Thank you for watching.